Hey everyone, it's Anna Samuel, the founder of White Coat Wonders, a medical blog and interview series that helps teens explore and demystify the world of medicine through real stories and not just science textbooks. Today, I'm so incredibly honored to be joined by Dr. James P. Thomas, a nationally recognized oncologist, researcher, and clinical trials leader at the Medical College of Wisconsin. From the bench to the bedside, he's helped shape the future of GI cancer treatment in Wisconsin and beyond. Let's dive in. Good morning, Dr. Thomas.
Good morning.
To start off, your work on reactive oxygen species ROS spans decades. What first drew you to these molecules and how are they shaping cancer care today in the world?
I think I've always had a long-standing interest in reactive oxygen species and oxygen-free radicals. From my time as a graduate student, my dissertation was on lipid peroxidation in reactive oxygen species. My mentor during my graduate school, had an interest in that. And it became apparent as time goes on that it's a very important biological stress for a lot of things, as far as causing cancer, as far as cancer treatment, as far as heart disease and cardiac arrest and other things. And so trying to understand that biological and biochemical process and then seeing how it applies to different conditions, medical conditions, has been an interest of mine for a long time.
Yeah, it's very interconnected with different diseases and illnesses. From
Very.
colon cancer to pancreatic cancer, how have targeted therapies transformed what's possible for your patients over the
I
years?
think when you look at the evolution of cancer care and how much progress we've made lately, it's generally in two broad areas. One is immune therapy, is harnessing the body's immune system to fight cancer. The other item is targeted therapies, where we find something specifically wrong with the cancer is dependent on. We try to attack that area, that pathway, and the cancer is more susceptible. For targeted therapies, we've had more luck in some cancers like colon cancer, where we use epidermal growth factor receptor inhibitors, other items like that, which has a lot of benefit. Pancreas cancer remains the toughest cancer that there is, right? It's a very aggressive cancer. It's usually metastatic when it's found. We're working very hard, both in immune therapy and in targeted therapy, to find things that'll make pancreas cancer more treatable. And we've made some incremental improvements, but we still have a long way to go in that disease.
You've led clinical trials at institutions like UW, OSU, and now the Medical College of Wisconsin. What have you learned about designing these trials that actually work, and how do we get more patients involved in these studies?
Clinical trials are an aspect that people don't really recognize the fact that how big an undertaking it is. We have close to 200 people here at the medical college for cancer that work on clinical trials, and kind of developing that as a profession, as a career path for folks where they can be involved in clinical research, do something very meaningful and important, help us develop cancer therapies, something I'm very proud of. And so we're part of a national organization called the American Association of Cancer Institutes. And one of the things we've done is to work together with all the other cancer institutes in the country to try to develop clinical trials as a science, learn from each other about how to do it better and faster and cheaper. That's what translates into better therapies for people, right? So the faster and better that we can bring these trials and see if they work and get them approved, the faster it's going to help people. I've been fortunate to help lead organizing a cancer clinical trials office at Ohio State, and then I also did the same here at MCW. And again, got just some fantastic people that work with us in the clinical trials office, and they really do a fantastic job.
So, the tumor board is a powerful model approach in GI oncology. How does team based care improve these outcomes, and what would you say makes a great team member in these?
I think tumor boards are very, very important. It's a chance for multidisciplines to come together. So the surgical oncologists, interventional radiologists, the radiation doctors, the chemotherapy doctors like me, we can come together and discuss complicated cases and decide what diagnostic tests we need to do, what treatments we should pursue, what order those treatments should be come in, and coordinate care. For GI cancers, for example, we don't just have one tumor board for GI cancers. We have a pancreas tumor board, we have a colorectal tumor board, we have a liver cancer tumor board, we have a neuroendocrine tumor board, we have esophageal tumor board, esophageal and gastric. And each of those, again, have great attendance, and it's a great learning opportunity for trainees because all the people that are experienced in the care of these patients, we bring the latest research and the latest clinical trials and try and figure out what's best for patients in real time. So the patients we saw this week, we can say, okay, well, how are we going to approach this? What's the best way to tackle it? And as you're probably aware, being a regional resource for people in the state, we get a lot of the more complicated or rare or unusual cases here. So it's good to have a team of people that'll go over it and develop a plan.
Course. Dr. Thomas, you've mentored countless students and future physicians, but a lot of teenagers nowadays are still intimidated by medicine and think of it as some big, daunting field. What's one myth you'd want to break for curious high school students who are feeling like they don't belong in the field?
It's a fascinating field. It's very rewarding. Like most things in life, go with your passion, right? So
Definitely.
if you're interested in it, you're passionate about it, should really be encouraged, and people should shoot high. Realize that there's lots of great careers in medicine and in cancer, right? In addition to being physicians, there's pharmacists and nursing, there's physician assistants and nurse practitioners, there's clinical trial coordinators. Depending on people's skill set or what their interests are, there's different things that you can find. I came from a small rural high school. There were no doctors 10 years before me or 10 years after me
Oh my
and
goodness.
from the high school that I came from, right? So I didn't
Wow.
really have much of a role model. Obviously, I had lots of advantages as far as going up through school and stuff like that. But, my parents didn't think that I could be a doctor. They thought you had to be like a child of a doctor to become a doctor or something. My dad thought so. And obviously, people, if they work hard, it's there for them. I like it because it's challenging, because it's changing, because you can be part of that change. Complicated things, and I like helping people. So it really fit kind of what my skill set was and also what my interests were.
That's amazing. From biochemistry to bedside, what part of your work still excites you or surprises you after all of these years in your career?
The interesting about cancer is that things do change quickly, right? So you can
Mhm.
take something that's literally in the bench, petri dish or a mouse. Within a couple years, that can be tested on in people. A couple years from that, it might become FDA approved. So it's an area, because there's so much need and because there's so much science that goes into it, it's an area that's rapidly evolving. And so to be able to see a drug that you worked on or helped develop or help get the clinical trial going and have that be, shown to work and then be approved and be out there helping people. And then you can walk into a room and tell a patient and their family that we used to not have many choices, but now we have A, B, and C of ways to help you and way to treat this cancer. It's very rewarding.
It's so full circle. You've been called a partner in the journey by many patients. How do you personally balance realism versus optimism when you talk to someone who's newly diagnosed?
I think that balance is important, right? I'm an incredibly optimistic person. You shouldn't go into cancer or cancer research or cancer treatment unless you're optimistic, right? On the other
Okay.
hand, patients need to know that they have a serious illness, that things don't always go right, and that there's a chance that things will help, and sometimes there's a chance that they won't work. And so I think I try to be very, very upfront with patients of the seriousness of the illness, what we're going to try to do, that I'm always going to be honest with them and let them know whether things are going good or bad. And I think generally people appreciate that as far as being open and honest. And yet they also want to know that you're willing to try things and that you have things to offer them to try and see if you can help out with their problem.
Is there a specific moment or event that happened during your career that stuck with you all this time through medicine that has brought you some sort of joy in your life?
There's so many, things. It's a privilege to be helping people and being part of the journey with people and their families. So it's a tough job as far as that people have tough diseases and people pass away from it. To be able to get close to these people and to be with them on the journey and to help them as best you can is a very, very rewarding. When I was a medical student, president of the medical college gave me a quote that always stuck with me. He said that the best way to care for people is to care about people.
Yeah.
For whatever reason, that has always stuck with me. That if you start out just caring about them, do a good job giving them care.
When I was shadowing in the MRICU, I was with nursing or medical residents, and they said there had to be like a superficial bond with your patients because you can't like relate to their pain, but you can feel sympathetic towards them, would you say?
I think you have to try to be empathetic as far as what they're
Yeah,
going through, right? As far as to, even though you're not experienced to that, you have the experience of guiding other people through this situation. And so talking it through and seeing what they're feeling and really trying to connect with them, right? Because it's difficult for people to connect. We always say the most important part of the care is the history, right? As far as being able to get people to talk about how they're feeling, what symptoms they have, is really the key to giving people good care. And so you have to work hard and put energy into that connection.
of course. So this interview is part of a broad collaboration with Right Audacity, a movement fighting cancer through community and research. Can you share what this event has meant to you and how it's helped MCW push cancer care forward?
I think we're really excited about Daxity this year. It's doing a great job raising money for cancer research, and 100% of the money goes towards cancer research. And that way we can both, fund trainees, the brightest young people, and get their careers started right. Then also kind of take the high risk, high reward ideas, not the incremental advances, but the high risk, high reward ideas, and invest in those and see which one of those come to fruition. So we're very excited about that. But moreover, it's a time for us to come together and remind us of what we're all fighting together for, right? Because it's
Definitely.
not just the researchers, it's the patients, the families, the people that care about people with cancer that are all coming together for this ride. And some people are riding, and some people donated, and some people are volunteering. I'm looking forward to it so much as far as just being a bonding event for a group of people on a common mission working together to fight cancer.
My friends and I are all going to go bike on August 17th.
Looking forward to seeing you there.
So I'll see you too.
Yeah.
So, looking back at your path with undergrad, med school, PhD, and your fellowships, was there ever a moment that you almost didn't feel like you wanted to pursue medicine? If so, what kept you going?
Well, I knew I couldn't sing or dance, so Broadway was out of the question, right? As
Dang
far as,
it. Dang
yeah,
it.
so shoot. So medicine was my backup. Not that there weren't long days and long hours and things like that. My friends and my family and my mentors that have supported me, I think helped me get through it. You look back and you see the positive things, and the challenges, sometimes diminish over time that you look back and remember again, I remember the training and everything, appreciative of all the people that helped train me and help, guide me to this point.
I've heard that you need to have a support system in medicine, both in like your field with your team, with the people you work with, and outside of medicine. Would you agree?
I think that's very important. Having that kind of solid base and people that you can talk to as you're going through it, both in the medical field and then your home base also.
Well, thank you so much, Dr. Thomas. Your journey and
Well,
insights that I learned from you were amazing. You're showing like medicine can be both precise, obviously you're treating people, but you're also giving them like more time or memories, hope with their family. So yeah, thank you so
that's right.
much.
Well, good luck with your project and look forward to hopefully bumping into you at the bike ride.
Yes, I'll see you there. Huge thank yous to Audacity and the Medical College of Wisconsin's Cancer Center for fueling this kind of work, and a special shout out to Grace for making this interview happen. Audacity's annual ride is coming up this August 17th, and as Dr. Thomas mentioned, 100% of the proceeds go towards cancer breakthroughs right here in Wisconsin, so click the link in the description to enter now. For more interviews like this and to read the blog recap, go to whitecoatwonders.com. Don't forget to like, subscribe, and comment which specialty you'd like to see next. See you in the next one!